Hey, welcome to our aortic aneurysm crash course. I'm doing a different video where I'm just going to do this in parts, and I'm going to make this as fast as I can. Okay, here we go, okay? Aortic disorders, specifically aortic aneurysms. Aortic aneurysms are the most common aortic problem, disorder, whatever you want to say. It is the most common thing to happen with the aorta. Let me get that away from the camera. So, aortic aneurysms are broken up into two different categories. You have your true aortic aneurysms, which only involve the wall of the aorta, so it will at least just have one layer involved, whereas a false aortic aneurysm involves all the layers. The way I remember this is like this. True aneurysms have a bulge. False aneurysms don't have a bulge. Doesn't make sense when you look at the pictures, but let me explain it. So think of it like a grape. Your false aneurysm looks like a grape is being pinched off, like a branch. It's just kind of hanging out there. It doesn't look like it belongs there. It doesn't look like it's part of it. And then you look at your true aneurysms, and it's like this grape is infused into that vessel, and this one, the grape is stuck. So these two have bulging because the grape is there. It's connected. It's inside or it's connected. Hopefully that makes sense. That's how I differentiate them, okay? So this one, saccular, you can remember it's saccular because there's a sac on the side. The other one that's a true aneurysm is fusiform. You can remember fusiform because it looks full. And then our only false aneurysm, I shouldn't say only false aneurysm, but what we call a false aneurysm is a pseudoaneurysm. And like I said, you'll see that all the layers are involved. It looks like a grape that's about to be pinched off. It does not look like it's part of the vessel like these do. Okay, so let's move on. I don't know why I said it like that. Anyways, moving on. What are some causes of an aortic aneurysm? Mechanical, things such as trauma, especially penetrating. Anything that's a penetrating injury or trauma can cause this. Inflammatory diseases, I put in there aortis, but any inflammatory diseases of the aorta can cause this, or even infection can cause an aortic aneurysm. So what are some signs and symptoms of an aortic aneurysm? So just overall broad common signs and symptoms that we may find is pain that mimics abdominal and back disorders, a pulsating mass in the abdomen, specifically to the left, or I should say the abdomen, in the umbilical area, the periumbilical area, I think is what I have written, and it'll be to the left. You may have bruit present, and you may have blue toe syndrome present. And blue toe syndrome is just a modeling of the toes. They just look a little bit blue, okay? So now moving on, these can actually be broken up into two subcategories, thoracic aneurysms and ascending, I say ascending, but an ascending aneurysm, I guess, is the way I can explain it. So your thoracic aneurysms are normally going to be asymptomatic, but if they are having symptoms, they're going to have deep diffuse pain that may travel up to their scapulae, okay? With ascending, they're going to have angina due to the fact that there is not a lot of circulation, and they may have a transient ischemic attack, TIA, due to the fact that blood is not flowing, right? Okay, they may have shortness of breath, they may have a cough, they may have JVD. They also may have difficulty swallowing because this aneurysm is pushing on that laryngeal nerve. They might also have some lower extremity edema. Okay, now that we've covered the basis of signs and symptoms of aortic aneurysms, let's move on to a complication that can happen with an aortic aneurysm. Rupture, okay? Rupture of an aortic aneurysm is an emergency. And we know that with aortic aneurysms, rupture is more likely to happen with our smokers, okay? And one of the signs that a rupture may have happened is that your patient has a level of consciousness change. So also, we can look at what signs may be showing where it's at. So with the rupture, so with the rupture, in the retroperitoneal space, you're going to see a gray Turner sign, which is that flank bruise that we saw in pediatrics with those kids. It's going to be a bruise that kind of goes across the flank here, right? And then with your thoracic and abdominal ruptures, there's going to be massive hemorrhaging, and there's going to be signs and symptoms of hypovolemic shock. And obviously with that, we know that you're going to have decreased urinary output. So now that we know all this, Let's move on to some surgical treatment that may involve with these. Alrighty, let's move on to our interventions that we'll do for aneurysms. Obviously, we're for sure going to do some surgical repairs, right? So just note that both these surgical repairs may have risk factors for acute kidney injury. So let's talk about our first one, an open aneurysm repair. This is a large abdominal incision. So with that being said, this operation, they cut into the deceased portion and remove any plaque or thrombus that may be there. From there, they may insert a synthetic graft where they did the operation, or they just may have a closure of the area. Important thing to note about this operation is that it is required to be cross-clamped for 30 to 40 minutes. And a complication that may happen after OAR is post-op ileus due to the fact that we're manipulating around all the intestines and stuff because we're opening up the abdomen. Okay, the second intervention we're going to do or may do, or I shouldn't say intervention that we will do or may do. Another intervention that is an option is endovascular aneurysm repair, also known as EVAR. So this utilizes the femoral artery, and multiple materials are used in this. I think the one we said in class that was most common is a Decron type of material, which kind of looks like an accordion, like that little white accordion that we saw in the aneurysm repair. And this is delivered through both femoral arteries. Key thing to note with EVAR is that normally there's less complications. Kind of makes sense because you're going into the femoral arteries as opposed to making this large abdominal incision and you're digging around other things, right? So let's talk about some complications of these operations. Most common complication that you'll see is an endoleak, which is the seepage of blood into the original aneurysm, is the way the book described it. But I'm going to go based off of our PowerPoint. So an endoleak essentially means that an aneurysm is either above or below the graft that was placed, or possibly there's migration of the graft causing an occlusion. So with that being said, people who've had EVAR are going to be monitored for this specific complication for life. Remember that. Endoleak, EVAR, for life. They're always going to be monitored for that. Moving on, our other complication is intra-abdominal hypertension. This is a lethal complication. Why? Because due to this hypertension, there's decreased blood flow, and decreased blood flow equals decreased perfusion, and decreased perfusion means organ failure, right? So our treatment for intra-abdominal hypertension is going to be decompression and support of the systems that are involved. So, that being said, that's everything about aortic aneurysms.